Hey, folks, I'm so glad you could spend a little time with me. Glad you're here. And if you've been listening to the news lately, there's a big news story out there on opioid use. And I was talking to one of my friends the other day. In fact, was it today? Maybe yesterday? Anyway. And they were saying, well, weren't opioids always used for pain? And absolutely. And I was at dinner the other night with a friend of mine who's a chiropractor and a new friend of ours. He's an attorney, a neurosurgeon, and a dentist. And this topic came up again. It seems to be a hot topic among doctors. And he said, too, and I agree with this, that sometimes opioids are absolutely positively necessary. And my one chiropractor friend said, if you're passing a kidney stone, you need something big to kill that pain fast, because a kidney stone is kind of like spikes. If you imagine the cuckleburs, I think they're called, and it's passing through your urethra, which is really small. It's just tearing your urethra up. And so you need something that's really going to block that pain. And opioids in cases like that are necessary, I feel. But now we have a problem. They've been used and now they've been abused. And then somebody else asked me the other day, too. They said, well, why is it a problem? Because some people seem to be able to take opioids and they don't have an addiction. And other people take them once and they're addicted. And I said, yeah, it just depends on the personality. And then last week I was talking to a dentist friend of mine about this. And his wife, unfortunately, had died. She started taking opioids. She hurt her back. Didn't go to a chiropractor. She went on for medical treatment. And nothing wrong with that. And she started taking the opioids. She became a heroin addict. He said she was buying heroin in the streets. And as a dentist, very classy guy, very successful practice, he said eventually she died from it. So it's a big issue because you don't know if you're going to become an addict until you try it. And once you take it, many times there's no turning back. So let me read to you, and this is actually some good news that's happening in the world, a letter from, it's the National Association of Attorneys General, dated September 2017. So let me read the opening paragraph. The undersigned state attorneys general are sending you this letter to urge American health care insurance plans to take proactive steps to encourage their members to review their payment and coverage policies and revise them as necessary and appropriate to encourage health care providers to prioritize non-opioid pain management options over opioid prescriptions for the treatment of chronic non-cancer pain. So here we are. The state's attorneys general, that's how it's pronounced, are now recommending to the insurance companies that they should be covering the alternative treatments because it's in their benefit. Economic toll of the epidemic is tremendous, costing the United States estimated $78.5 billion annually. State and local governments alone spend nearly $8 billion a year on criminal justice costs related to opioid use. The human cost is even more staggering. Opioid overdoses kill 91 Americans. How often? Every single day. More than half of those deaths involve prescription opioids. So it's come to the forefront, and this is something I've been talking about for about 35 or 40 years. So this is nothing new. We should be looking for the least invasive treatment when it comes to pain management. Start there and work our way up. And once again, and I this is a very touchy subject, but I'm going to put this in the Dr. Joe is right column. And that's a long list. I've talked about a lot of things about nutrition and health, and finally these things are coming to fruition. Now, this is coming to fruition, that we should look for less invasive treatments for pain and getting to the cause of the pain, not just treating the symptoms. That's the key. Because if I have a headache, I have no problem taking an aspirin or an acetaminophen or an ibuprofen. Acetaminophen, by the way, blocks pain. Ibuprofen reduces inflammation. The I and I, ibuprofen, inflammation, acetaminophen blocks pain. So sometimes reducing inflammation works, sometimes blocking the pain works. And that's why sometimes you take a mixture of both. But if I take a medication, me, you, anyone, I believe your goal should be, why do I have this headache? Why do I have this low back pain? And get to the cause of the problem. Let me read the last paragraph in this letter from the National Association of Attorneys Generals. When patients seek treatment for any of the myriad of conditions that cause chronic pain, doctors should be encouraged to explore and prescribe effective non-opioid alternatives ranging from non-opioid medications, such as non-steroidal anti-inflammatories, to physical therapy, acupuncture, massage, and chiropractic care. So here we are. Chiropractic first adjustment was September 18th, 1895. And now, finally, the rest of the world is catching up with what was discovered September 18th, 1895 in Davenport, Iowa, that we should get to the cause of the problem and not just treat the symptoms. I think we should treat the symptoms and also get to the cause. And if we do that, we're in good shape. And now the question comes up is, why don't insurance companies do this? And that's what the attorneys generals are asking. Adopting an incentive structure that rewards the use of non-opioid pain management techniques for chronic non-cancer pain will have many benefits. This is what we've been talking about. Given the correlation between increased supply of opioid use, societal benefits speak for themselves. Beyond that, incentivizing opioid alternatives promotes evidence-based techniques, such as what we just listed, that are more effective in mitigating this type of pain over the long run, more cost-effective. So everyone wins: society, patients, and the insurers. So here's a chance, finally, after all these years, to say, okay, who's going to win if we can get people out of pain without using these addictive drugs? And again, I'm not against using the drugs if necessary. You, the patient, wins. The insurance companies save money. You, the patient, save money. Society saves money because now we don't have the, $8 billion a year we spend just on the legal system for people using and abusing these drugs. So hopefully this is a breakthrough, because society is now saying, okay, this is silly. And I find this in my life. You see things that are just outrageously overpriced, and eventually competition comes in and lowers the price. Well, now we have a price higher than money. We have people's lives at stake. And now finally someone, state's attorneys general, and also I'm going to talk about too in a second, the Joint Commission, which accredits hospitals. We're going to talk about that after the break. The Joint Commission that certifies hospitals, what they're recommending to the hospitals, and it's going to be exciting for you. Now, one more comment before I go to the break. Although in some conditions, behavioral programs, acupuncture, chiropractic surgery, as well as FDA-approved multimodal pain strategies have been proven to reduce the use of opioids while providing effective pain management, current reimbursement policies, the insurance companies, as well as health insurance providers and other payers, create barriers to the adoption of these strategies. The insurance companies are making it hard for you to seek out alternative health care. I hope that in 2018 this changes. Folks, going to have to go to a break. I'm going to open up the phone lines. If you have a question, any type of healthcare question, the number here at the studio is 844-44-Dr. Joe, 844-44-DRJOE. My website, if you have questions, you don't want to get on the air, drjoeesposito.com. We archive all our radio shows there. We have articles there you can read, watch videos of my lectures. Really good source of information. That's drjoeesposito.com. When we come back, the Joint Commission, what they're recommending when it comes to management of healthcare. Hey, tell your friends about the show. Don't go anywhere. We're going to be right back. Hey, folks, thanks for being here. I am Dr. Joe. Good show today. Well, all the shows are good. Today's an exceptionally good show. We're going to talk about in just a second, the new recommendation from the Joint Commission. This is a group that certifies hospitals, accredits hospitals and healthcare facilities around the country, and what they're saying about the opioid crisis. Now, some people can take opioids. These are medications that block pain, and they can take them and have no problem whatsoever. And they can take them short-term, they can take them long-term, sometimes for cancer treatment, sometimes after surgery. You take the opioids, you take them as directed, and you have no problem. Other people, once they take it even one or two times, they can get addicted, and they just can't stop themselves. Just like alcohol. I don't drink anymore. Last drink I had, I was 28 years old. I never liked alcohol. I never liked the way it made me feel. But if I have a drink, I'm not going to become an alcoholic. I'm not going to have to drink more. I don't have that brain capacity. Other people have a drink, and they're off the wagon, so to speak. If you've ever been to an AA meeting, or if you've ever known an alcoholic or are an alcoholic, you know you can't have one drink. Some people can, you can't. Some people are like that with sugar. If you eat a little bit of sugar, you just want more. And what happens is it stimulates a part of your brain called the nucleus accumbens, and it releases dopamine. It stimulates the dopamine receptor sites, and you get so excited by it that you want this external source to get you high, and that's called an addiction. Addiction is anything you do on a regular basis that adversely affects your lifestyle. And so when you start taking these drugs, some people can take them short-term, some people can't. But the good news on this front is that things are being done. The Hospital Association is starting to recognize that there's a problem. So imagine you go to a hospital and you have things like chiropractic, acupuncture, massage therapy, meditation, as your primary treatment may not be too far in the future. It's not so far-fetched. Joint Commission, which currently evaluates and accredits more than 21,000 healthcare organizations and programs throughout the United States, including nearly 90% of all U.S. hospitals, has issued revised pain assessment and management standards. So what I've dreamed about for 35, 40 years now may be coming to fruition, where we actually get to the cause of the problem and we work together. Because some people need opioids, some people need surgery, some people need chiropractic care. How do you decide? In fact, coming soon, as a matter of fact, I was at a dinner the other night, and a medical doctor, her and her staff were there, and they said, listen, we want to refer. We love when patients go to chiropractors, but we don't know the protocols as to when to refer. And I mentioned this Joint Commission, and she's the marketing director, or whatever she was, PR director of the doctor's office, said, will you come to our office and teach us referral protocols? And I said, absolutely. We're going to have that happen in a few weeks. So it's exciting that 20, 30 years ago, everybody was fighting. The neurosurgeons didn't like the orthopedic surgeons, and the chiropractors and the medical doctors didn't like each other, and the physical therapists and the chiropractors were fighting. And massage therapists were out there because they didn't have a license, so nobody wanted to talk to them. And now suddenly it's all coming. Acupuncture, oh my gosh, that was voodoo and witchcraft. Now it's being taught in medical schools, chiropractic schools. So let me talk about the standards. Effective January 1st, 2018, require the Commission's accredited hospitals to provide non-pharmacologic pain treatment modalities as necessary performed for the patient. Chiropractic is included among the potential non-drug treatment options hospitals can utilize to meet this standard. So this is the new standard. How exciting is that? That now suddenly, when you go in a hospital, it's not just, here's a drug, get out of here. Or, yes, you absolutely positively need surgery. Let's look at the patient, and let's see what happens. Let's go to the calls. We have a really good call. If you have any questions, give us a call. 844-44-Dr. Joe, 844-44-DRJOE. The lines are open right now. Ed, how can we help your day get better?
Dr. Joe, do appreciate your time, sir.
You're welcome.
So I'm actually calling for my wife. She's had over a dozen years worth of extreme sciatica,
Sure.
L2, L3 fracture, and also degenerative arthritis. It doesn't hurt that she's got fibromyalgia and low-performing thyroid. So what she ends up is with not the energy to kind of grunt through the pain, which, right now, according to her P&P, she's at a 7, where breaking a leg is a 6 out of 1 to 10.
Right. Mm-hmm.
And that's with the fentanyl patch at 75 milligrams.
Wow.
Every other day. So I don't know that there's a solvable issue here, but if I get a chance to talk to you, you bet I will. I'll listen to anything you've got to say.
All right. Well, let me tell you this. I'll give you my story. I broke my back when I was young. Fractured L5, fifth lumbar. And I played football and hockey, and I would be in excruciating pain. And back then, it's like, well, muscle through it. You're a sissy. Don't worry about it. Finally, at 18 years old, I had my first x-ray. I had a fracture at L5, still there. Degenerative arthritis in my low back, still there. And severe shooting pain down my left leg to the point where I was actually thinking, how can I cut off my own leg? This pain is so bad, if I cut off the leg won't feel pain. I mean, those were real thoughts in my mind. So I totally understand what she's going through. What I found did wonders for me were several things. Number one is, even though it was fractured and it healed, chiropractors could still manipulate my bones back to a position where they weren't pinching the nerves. Because if she broke the bone, she also dislocated the bone. And we got to fix that dislocation and put it back in place. Then we got to work on the muscles. Sometimes the psoas muscle is involved, which is a muscle that is a hip flexor. Sometimes it's your piriformis muscle. You got to work on that. It's a muscle in your butt area. So physically realigning everything, in most cases, does wonders for patients like her and me. Second thing is, we got to get her on an anti-inflammatory diet, bring down the inflammation, and that would help tremendously. And then with the fibro, we got to get her on a lot of raw foods, things like Dr. Joe's Super Greens, Dr. Joe's Essential Source, salads every day, because the enzymes are going to help break up the inflammation. So
Question: If
yes.
she's nibbling on meats and cheeses and crackers all day long, that's not helping at all, is it?
That is throwing gasoline on a fire.
Okay.
Absolutely. If she's in pain now, when she stops that, the pain should reduce dramatically, yes.
Okay.
Because so she sounds like she's doing everything that's making the problem worse. But this is my personal story, Ed. I can't talk about menstrual cramps. I don't know I know how to fix them. I don't know what they feel like. I can talk about fractures and sciatic pain. So I'd strongly advise you either get her to see us or somebody to get that thing fixed as quickly as possible.
Understood. Thank you very much for your time, Doctor.
Thanks, Ed. I appreciate it. And that's why the Joint Commissions now are coming out with the Joint Commission is coming out with these new recommendations. Because here's a woman, 10 years, medication, but they never got to the cause of the problem. Now, can we help her? I have no idea. Is it worth a shot? Absolutely. Every day, patients come in our offices and say, Dr. Joe, I've been meaning to come see you for the past 5, 10, 20, 30 years. I just never did. So get off your fanny. If you want to come see us, go to my website, drjoeesposito.com, or just Google Dr. Joe. Super Greens, Essential Source, we talked about that. We'll talk about them later. Information there on the website, too, drjoeesposito.com. Hey, give us a call. Lines are open, 844-44-DR-JOE with all your healthcare questions. We'll be right back. Hey, folks, Dr. Joe here. Glad you could spend a little time with me today. Good show today, as always. Today, we're talking specifically about the new recommendations on pain management cases. And we just lost a really great caller. Where'd she go? Come back, Joe. Come back. Really good information that's coming out because for years, I've been preaching and writing in my books and in my lectures and in my seminars and my radio shows that we should really try to get to the cause of the problem and not just treat the symptoms. And now, finally, with the opioid crisis coming to a head, what's happening is the Joint Commission, which is a group that certifies over about 90% of the hospitals in the country, and National Association of Attorneys General are now saying, yes, absolutely, we should be looking to get to the cause of the problem and offering alternative options other than the opioids, because some people, when they take opioids, become addicted. Some don't. Some do. And we don't know who's going to become addicted or not. We don't have that technology to figure that out yet if you have that addictive brain until you do it. So now we're saying, what if we got to the cause of the problem using things like physical therapy, acupuncture, chiropractic care, massage, trying to get to the cause of the problem, not just treat the symptoms. I've spent 33 years of practice, 6 and 7 days a week, getting to the cause of the problem. And in most of my patients, they're extremely happy. Our patients, I have a team of doctors now, they're very, very happy with the results. And the few times that patients aren't happy, it's usually because they didn't follow our recommendations. Because we try to get to the cause of the problem by finding out, is it a pinched nerve? Is it a muscle spasm? Then we try to find out what's your diet like. If you have a bad diet or you're eating inflammatory foods, that can increase the pain. And then the next thing flows perfectly with Leon. Leon, how can we make your day better?
Yes, sir. My wife has just been diagnosed Thursday with a hiatal hernia, and we were just wondering what she could do as far as they recommended maybe surgery in the future, but what she could do as far as her diet and maybe some non-medical things that she could do, or maybe if you could help her in your office.
Sure. Well, once again, my story, I have a hiatal hernia. I was never, I diagnosed myself because I know the symptoms. I know what happens. I diagnosed myself. And for years, burping, gas, probably what would have been called ADD back then, because the stomach's job is to take proteins and break them into amino acids. And amino acid tryptophan becomes serotonin in your brain, and serotonin helps you calm down. So many times when there's hiatal hernia issues, there's also emotional components involved. And every emotional patient I've ever seen where there's anxiety, depression, bipolar, ADD, there's always an undiagnosed or untreated digestive problem. Now let's answer your question. The stomach sits below your diaphragm. You have a sheet of muscle called the diaphragm, and below your stomach is your diaphragm, and there's a hole in the diaphragm. So you swallow food, it goes down your esophagus, hole opens up, drops into your stomach, hole closes, called the lower esophageal sphincter, and the food digests. In your wife's case, and in my case, the stomach is pushing up through that hole. When the stomach pushes up through the hole, it's called a hiatal hernia. So the surgery, what they do is they open you up, they pull the stomach down, they sew up that little hole, and hopefully it works. Sometimes it does, sometimes it doesn't. Many times scar tissue forms. Now, I'm not saying she doesn't need the surgery because I'm not a surgeon. I don't know if she does or not. But what I find, and my team of doctors finds so often, is we can actually adjust or pull the stomach down away from the diaphragm, physically moving the stomach. Just like a surgeon would cutting you open, we just do it from the outside. The success rate is extremely high in doing this technique. And if you go to my website, which is drjoeesposito.com, I think, and go under blogs it is. Under blogs, it'll have Dr. Joe's articles. And I think it's like the 7th or 8th article down. It's an article on GERD, gastroesophageal reflux disease. And it's a neat little diagram we drew and how we fix the hiatal hernia. So if you read that article, it's real quick. It's only a couple of paragraphs. It is the #1 downloaded article on our website by far because so many people have what your wife has, Leon. So the answer is, can I help her? I don't know. Have we helped thousands of patients like her, myself included? Yes, we have.
Okay. All right. She's going to try to get an appointment then.
Well, I think that'd be the best thing. So let's get her in. And if we can help her, if we think we can help her, we'll tell her. If we can't help her, we'll definitely tell her that too.
Okay.
Fair enough?
Right. Fair enough.
Thanks, Leon. Appreciate the call.
Have
Thanks
a good
so
night.
much. Bye. Yeah, and folks, if you need to reach us, my website is drjoeesposito.com, or just Google Dr. Joe with the #1 Dr. Joe in the world. And when it comes to pain, and we're going to continue on with this pain topic, we've got a lot to cover here. The joint 2017 revised the standards. They do not prohibit the commission-accredited hospitals from pharmacological approaches. So they're not saying don't use drugs. Make sure we're clear on this. What they are saying, the standards emphasize safe opioid and non-opioid prescribing use, patient education on pain management plans of care, and potential side effects of treatment. So what the Joint Commission is saying is that you need to tell a patient, if you take this, this is what can happen. And then the standards also make pain assessment and pain management an organizational priority to be adopted by the hospitals. So they're saying that the hospitals are now going to say, well, they should say, hopefully they will, it's the new guidelines, new law, is, listen, if you're going to do this, here's some options. Maybe we can try acupuncture. Maybe we can try chiropractic care. Of course, that's what I support, #1. Maybe we can try, they haven't talked about diet, which kind of concerns me, and I wish they would talk about diet, because so many foods are acid forming. And when you eat acid foods, I call them the 7 deadly sins of nutrition: alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. When you put these acid foods in your body, it irritates the nerves and increases, in most cases, the pain. So I know personally, and I know from all the thousands of patients we've worked on over the years, is if we can get the joints lined up, the spine, all the joints, there's 206 bones in the body. If a joint is out of alignment, it can be pinching a nerve, causing the pain. Most of the time, that's the cause of the pain, by far majority. And we put it back in place, it should help. Sometimes it takes more than one treatment, folks. Don't come see us and come in 1 or 2 times and say, well, it didn't help. No, depending how bad the problem is, how long it's been there, is there arthritis, will determine how long it's going to take for you to respond. If you have the hiatal hernia, like Leon's wife, you might not be digesting your food properly, and these relatively big chunks of food that aren't being digested can be absorbed into your system, and the immune system starts attacking them. And that can lead to inflammation. You can have inflammation in the bowels, which then can become systemic and go throughout the whole body. So we always check the digestive system or ask about it on our patients because we may have to pull that stomach away from the diaphragm so you can digest your food. Then we get you on a more alkaline-forming diet. We get you more on fruits, vegetables, nuts, and seeds, if you're willing to do it. If you're not, we'll just do chiropractic care with you. We'll just work on your stomach. We'll give you whatever you want, but we'll tell you what you need, and hopefully you'll listen to us. I recommend supplements. I always recommend Dr. Joe's Super Greens and Dr. Joe's Essential Source as part of my pain management protocol. Also for good wellness as well. Because the Super Greens, the Essential Source, have a lot of nutrients in them, minerals that can neutralize free radicals and help reduce inflammation. So I think everyone should be on Dr. Joe's Super Greens and Dr. Joe's Essential Source, and there are some guidelines I follow. At least do that, folks. If you're not willing to do anything else, do the Super Greens, the Essential Source. It's about $2.50 a day for both the Super Greens and the Essential Source. And most people report they eat less food when they're on it because they feel fuller, so they actually save more money than it costs them to take the supplements. So if you want more information on the Super Greens, the Essential Source, drjoeesposito.com, or just Google Dr. Joe, #1 Dr. Joe in the world. They're also on Amazon. If you have an Amazon account, you can order Super Greens and Essential Source on the Amazon account. But, folks, at least do that, and then we add everything else to it. Hey, if you have a healthcare question, lines are open, 844-44-DR-JOE, 844-44-DRJOE. That number rings through to my offices when I'm on the air. Follow me on Facebook. Follow me on Instagram. We send out lots of good information there. Hey, don't go anywhere. A lot more to talk about. Tell your friends about the show. We'll be right back. Tell your friends about the show. We'll be right back. Hey, everybody. Thanks for tuning in. Do appreciate you taking time to be with us today. We're talking today about the new guidelines that are out for pain management. Because you've heard on the news, I'm assuming, unless you live under a rock, there's a big opioid crisis and that people are dying from opioids and that we have quite a few people dying literally every day from opioids, $78.5 billion annually. 91 Americans die every single day from opioids, and most of those, more than half of those, are involved from prescription opioid usage. And some people, when they take opioids, it's great. Stuff's amazing for controlling pain. However, some people become addicted, and there's no way of knowing that until we give the person the opioids. And when they do, they become addicted, and many people will lose everything they've ever had trying to get more because the doctors are real careful. Remember a while ago, I hurt my back really bad, and a friend of mine, a very close friend of mine, who's a medical doctor, she, took me through the ringer before she would prescribe. It wasn't even opioid. It was just a painkiller. And she was very specific, and she said, listen, Joe, you're a very good friend of mine. You're a dear friend of the family. However, got to make sure I'm following all the guidelines. So the doctors, they know that this isn't something to play with anymore. So the Joint Commission, this is a group that accredits hospitals. They are now saying that they're going to recommend, the hospitals have to recommend alternative therapies to the opioids, including things like acupuncture, chiropractic care. So the Joint Commission's revised standards represent a continuing trend by healthcare organizations toward non-drug pain management and away from the opioids and other drugs. 30 years ago, I'm a chiropractor, it was illegal, essentially, for medical professionals to even associate with chiropractors or acupuncturists or massage therapists because that was voodoo, that was witchcraft, that's what quackery. And now, I would say at least once a week, usually more than that, someone from the medical community reaches out to me in my office and wants to talk to us, wants us to show them how we manage pain, wants us to talk to their patients. I had one surgeon, he does a bypass surgery, a gastric bypass. And he says, listen, the problem is that our patients, we do the gastric bypass, they lose weight and then they gain weight right back. And he says, the problem is we don't do any nutritional counseling. And I think it would be great, he said to me, I don't understand nutrition. It would be great if you would do nutritional counseling with our patients so that we can, once we get them to lose the weight, they can stay off the weight. They can keep the weight off. I said, absolutely. And a lot of doctors are doing this. So years ago, nobody was reaching out to anybody. Like I said, the orthopedist didn't like the neurologist, the neurosurgeons didn't like the orthopedic surgeons, and the physical therapist and the medical doctors argued. And now it's becoming homogenous. And that's real exciting for you, the patient. And when the insurance companies finally get smart and realize the least expensive, most effective treatment for back pain, low back pain and neck pain, now the studies are coming out, is chiropractic care. Can it fix everything? No, it can't. Is it great at fixing it? It's the most effective, least expensive, with the least amount of downtime? Yeah. So this is why the Joint Commission, one of the reasons the Joint Commission is now saying we need to offer these alternatives in the hospitals, and why other healthcare practitioners are reaching out to us and saying, all right, what do we do? How do we manage this together? And the other thing, too, I'll talk off the record here just between us, is they're realizing that we're a source of referrals. Because we, the chiropractors, see a lot of patients. 77,000 chiropractors in the United States licensed. We see a lot of patients. So we're an amazing source of referrals. And what's happening now is when I refer out, I get a report back from the doctors and say, this is what we've done with Ahmad, and we're going to make sure that Ahmad gets back to you for continued treatment if we feel it's necessary. When years ago, if you referred a patient out, they disappeared. They fell into the abyss. Oh, no, don't do that. Don't do that. In fact, we had one patient, she called in. Her question was she has epileptic seizures. The doctor put her on meds, but the doctor wouldn't consider natural options or consult with a chiropractor. She stopped the meds herself and has 1 or 2 seizures a year. What can be done naturally? So that's a real good question, because what I find with seizures is in fact, most epileptics I've ever seen, the top bone in their neck, called the atlas, is out of alignment. Now, I don't tell people to stop taking their medication, but many times when we can realign the atlas, the top bone, it takes the pressure off what's called the brain stem. Your brain kind of filters down into a funnel and then becomes your spinal cord. And so in a live person, the brain stem goes down to about just above the middle of your neck. And so if the top of the neck is twisted out of place, it can put pressure on the brain stem, which can cause seizures. So many times when we adjust or manipulate the upper part of the neck, that takes the pressure off that area, and that helps with the seizures. Then we look at their diet. If people are taking artificial sweeteners, aspartic acid, aspartame, too much aspartic acid can cause the nerves to fire faster than they're supposed to and actually cause seizures. And if you're doing things, aspartic acid, phenylalanine, and methyl esters is aspartame, but glutamic acid, glutamine, a little bit is good. Too much of it is an excitotoxin to the brain as well. So I've had people have seizures after eating Chinese food, after using artificial sweetener, diet sodas. And so then we do a dietary workup with them and say, okay, what's the problem here? Is it a reaction to the aspartic acid? Is it a reaction to the glutamine? And if it is, then we just get them off those foods. It's pretty simple. And then we always check their digestive system, because your stomach's job is to take proteins and break them into amino acids. The amino acid glutamine, we just talked about, becomes GABA. GABA suppresses other neurotransmitters and can help with seizures. And all of us, we're all capable of having seizures, but we're suppressing them constantly. 90% of the nerves in your brain are suppressing the other 10%. So if that suppression is out of balance, that can lead to seizures as well. So I always check the diet, I check the nerve supply, and then I check the digestive system. And in many cases, we get real good results. Why this woman's doctor didn't consult with other doctors, I don't have that answer. I don't know. Maybe they're old school. Maybe they're afraid they're going to lose the patient. You know, it's like if you love something, set it free. Boy, that works with patients too. Hey, listen, we're going to co-manage this case with these other doctors. And the patients go, wow, my doctor's really looking out for me. They're co-managing the case. And that's what I found works great. And then you got to get the right nutrition. I'm going to throw it out there again. Dr. Joe's Super Greens and Dr. Joe's Essential Source. Somebody called up. I took them off the air. They said, would that help with Alzheimer's? I said, it might help. It's not going to fix it. But this is the starting point. This is the core nutrients that your body needs. Dr. Joe's Super Greens, Dr. Joe's Essential Source. They're 2 powders. Got to go to a break. When you need more information, go to my website, drjoeesposito.com. You can order them there. Also, Amazon, it's there as well. You can order them on Amazon. If you have a question, lines are lighting up. 844-44-DR-JOE, 844-44-DRJOE. That number rings through to my offices when I'm not on the air. Follow me on Facebook. Follow me on Instagram. We give a lot of good information out there as well. I have live lectures on my website as well. If you're a visual learner, we archive our radio shows, drjoeesposito.com. Hey, tell your friends about the show. We'll be right back. Hey, folks, Dr. Joe here. So glad you could spend a little time with me. Always glad to spend a little time with you. Thank you. If I don't say thank you enough, I should, because I know everybody's busy, and I do appreciate you spending time, and I do appreciate all the kind words you send to me too. You send me emails. You have a question? If you don't want to go on the air, the number is 844-44-DR-JOE. But if you don't want to go on the air, send them to me through my website, drjoeesposito.com, or just Google Dr. Joe, and we archive hundreds. I guess we have close to 1,000, if not 1,000 hours of radio shows archived there. We videotape my live lectures. A lot of people subscribe to our YouTube channel. Please do that, by the way. Subscribe to us, because this year we're going to put a lot more YouTube videos out. Little short ones, too, for those of you with attention deficit disorder. Real short ones on just little health tips. So make sure you subscribe to my YouTube channel. Follow me on Facebook. Follow me on Instagram. A lot of good information. It's all free. You don't want to miss it. And that's at drjoeesposito.com. And from there, you can get to my YouTube channel. Just go to YouTube and look me up. So we're talking today about the new guidelines for pain management. The National Association of Attorneys General is recommending, along with the Joint Commission, which is the commission that credentials over 90% of the hospitals in the country, on what to do when patients come in for pain. And they're trying to get people to use less opioids. And the way they're approaching it, which is what I've been talking about for 35 plus years, is let's see if we can find out why they have their pain. Now, if I have pain, if I have a blazing headache, I have some old spinal injuries. I broke my back, football, hockey, car accidents. I was actually hit by a car when I was about 10 or 11 years old in Germany, and they declared me dead on the spot. And obviously they were wrong, but I landed on my head. So there's some chronic old injuries there that rear their ugly heads every now and then. And when the pain flares up bad, I don't have a problem taking some acetaminophen, but then I instantly go to one of my doctors and I'll say, hey, check my spine, find out why I'm having this flare-up. And 100% of the time, my flare-ups are due to spinal misalignments, and I get my spine adjusted. I make sure I'm taking a good diet. I always take Dr. Joe's Super Greens and Dr. Joe's Essential Source, at least. And then I have a protocol for myself, and I'd love to put together a whole protocol for you on diet and supplements. And then in a day or so, my pain is under control again. It's gone. So getting to the cause of the problem is what the new guidelines are for the National Association of Attorneys General, the Joint Commission, the hospital associations. They're all getting together and saying we got to stop prescribing so many opioids. Because some people, when they take them, become addicted immediately, and some people don't. And we don't know if you're going to do that or not. And there's some new research out, too. You've heard me talk about, how pain, it can be irritated if you have a pinched nerve. And as a chiropractor, of course, my team of doctors were constantly looking for pinched nerves and fixing them. 90% of your nerves don't feel pain. So you can have a pinched nerve and not know it. So if you have pain, there's something wrong with the nerves. If you don't have pain, you still could have a pinched nerve. But now there's new studies out on what happens on chronic pain patients, and another reason we need to get to the cause of the problem. And the title of the research, it's from the Journal of Neuroscience. That's a fun one. I'm sure you have that sitting around at home. Chronic back pain is associated with decreased prefrontal and thalamic gray matter density. And I'll read it to you the formal way, and then I'll explain it to you. Patients with chronic back pain show a 5 to 11% less neocortical gray matter volume than control subjects. The magnitude of this decrease is equivalent to the gray matter volume lost in 10 to 20 years of normal aging. So if you have chronic back pain, your brain shrinks as if you were 10 to 20 years older than you are. Decreased volume was related to pain duration, indicating a 1.3 centimeter loss of gray matter for every year of chronic pain. So every year you're in pain, your brain shrinks 1.3 centimeters. So what does that mean? That means that when you're in pain, the brain is actually shrinking. And when the brain shrinks, it doesn't do as good a job as it used to. So here's another reason why you want to get to the root of your chronic pain. And the recommendations from the Joint Commission are alternative therapies such as, of course, my favorite, chiropractic care, acupuncture, physical therapy. And I'm seeing it more and more where doctors are coming to me. Hospitals, major universities have come to me and said, will you please teach at our universities? Because we want to learn what you have to offer. So far, my answer has been no, because I just don't have the time. But I will say, if you work for a hospital or healthcare center or pain management center and you need help in setting up your guidelines, let me know. I'll help you set up the guidelines on what to do when a patient walks through the door step by step. So you're following the Joint Commission guidelines and you don't get in trouble. And you could lose your accreditation, I'm guessing, based on this. So we got a lot more to talk about. Let's take some callers. Mike, how can we make your day better?
Yeah, I've got a friend of mine that has chronic back pain, and told me he's been doing pretty good by taking these ketamine infusion treatments
right.
at a pain management center.
Sure.
So my thought is, I have chronic back pain too, so I was just wondering what you know about those, or what do you think about it?
Well, ketamine is a medication, and it's used in pain control. Absolutely, it's one of the things that a pain management doctor, and I'm board certified in pain management. As far as I know, I'm the only chiropractor in the state that's board certified in pain management. And ketamine is something that pain management clinics use, and sometimes it's very effective, and it works by suppressing the pain, but there are a lot of side effects you have to worry about. Abnormal heart rhythm, a slow heart rate or fast heart rate, high blood pressure or low blood pressure. And again, it's showing that everybody responds differently to different types of medications. Some people have an increase in blood pressure. Some people have a decrease in blood pressure. It can cause skin rashes, eruptions on the skin, increase what's called intraocular pressure, the pressure inside your eye. And it can cause involuntary eye movements and tunnel vision. It can cause breathing problems, including stopping of breathing. So once again, the side effects, you can look them up online. I mean, anybody can do that. There are side effects to that, and that's why the Joint Commission is saying, let's see if we can do non-drug approaches first to see if that would work. So it kind of falls under the same guidelines as the opioids, in my opinion.
Oh, okay. All right. Thank you.
Thanks, Mike. Yeah, so folks, that's why so many patients come to our offices from all around the world, because they say, Doc, I really got to get to the cause of my problem. So we're talking about pain today, but here's a good question that is kind of not pain-related. Brenda, how can we make your day better?
Hi, Dr. Joe. Well, I'm kind of off a little bit from the pain, but I have like a fungus I was diagnosed with, and I was trying to see if I could find something natural to heal it.
You know what, Brenda, I'm going to have to go to a break. Can you hold on a second?
Sure.
All right, hold on 1 second. Folks, if you have a question, number is 844-44-Dr. Joe. My website, if you want to order Dr. Joe's Super Greens, Essential Source. We have Dr. Joe's Intestinal Cleanser. Hopefully I'll get to that when it comes to pain, how constipation can be related to your pain. Those are all on the website, drjoeesposito.com. If you don't want to go on the air, you don't get to me, you can always send me questions through the website, drjoeesposito.com, or just Google Dr. Joe. Follow me on Facebook. Follow me on Instagram. Make sure you subscribe to my YouTube channel. A lot of good stuff coming out in the next couple of weeks. Hey, don't go anywhere. Tell your friends about the show. We'll be right back. I am so glad you're spending a little time with me today. Thank you so much. We're talking today about the new guidelines for pain management and how the Joint Commission, the people at certified hospitals, and the National Association of Attorneys General are recommending strongly that we try to avoid the opioid approach to pain management and actually get to the cause. They're not saying this in these words, but that's what they're saying and what they're recommending is getting to the cause of the pain and not just treating the symptoms. And as a chiropractor for 33 years now, it's what I've been doing literally every day of my life, plus my education. And so I'm excited about this because sometimes we need opioids. I'm not saying don't take them. I'm saying take them when you need them. But if there's an alternative to the treatment, that's what I recommend. So we had Brenda. Brenda, you still there?
Yes, I'm here.
Okay, now you had a question. You have you said a fungus?
Yeah, it's like a skin fungus.
Skin fungus. Is it tinea versicolor?
Yeah, I know. I can. Let me spell the first name of it.
All right, hurry up.
SEBORRHEIC dermatitis.
Okay, seborrheic dermatitis. Okay, so when it comes to funguses, many times I find that's related to a systemic yeast infection. So what that means is in your colon you have good bacteria, bad bacteria, but you also have something called candida or yeast. And the candida live in your colon, and if you take a lot of antibiotics, or even if you eat a lot of meats or dairy products, commercial meats and dairy products oftentimes have a lot of antibiotics in them, it can kill off the bacteria, but it doesn't affect the yeast. So the yeast now kind of sets up shop and burrows holes into your colon and goes through your body, and it's called a systemic yeast infection. And when I see a systemic yeast infection, many times I see skin fungus as well. So one way you can test is tomorrow morning when you wake up, what I want you to do, Brenda, is get a clear glass of water, put it next to your blade. Wake up in the morning, get a big mouthful of spit, suck it off your tongue and everything, and spit into the glass. And you can wait up to an hour. And if you start to see little strings coming down, almost like a jellyfish, chances are you have a systemic yeast infection, which could set up the environment for the fungus to grow. So then you need to call my office, and we need to work really hard to get rid of that yeast infection. That's a whole supplement protocol, dietary protocol we put people on. It can take several months. It's not something that's easy to fix. But if you don't do it, that yeast can get bad. Fungus shouldn't grow on your body. From a topical standpoint, you can take something called tea tree oil, T-E-A-T-R-E-E, tea tree oil, and you can put it directly on the skin. It has a very nice smell to it, and that works really well to kill the fungus. And if it's a little too harsh for the skin, you can mix it with a little coconut oil. And that works really well to kill the fungus from the outside in, but then I also want you to kill the environment from the inside out. So try that. First spit in a glass, and if it is stringy, then you need to call my office and we'll work on that. But from a topical standpoint, let's try the tea tree oil.
Okay.
Okay? Thanks so much.
Thank you, Dr.
Appreciate
Joe.
the call. See, folks, it's not all about pain always. It's about getting the body healthy. Let's continue taking calls. I got a lot more to cover on the opioid crisis, but we can continue at another show if we need to. Mary, how can we make your day better?
Thank you for taking my call, Dr.
You
Joe.
are welcome, Mary.
About 2 days ago, I woke up just with the head with the room spinning.
Yes.
And so I had enough strength to get up and go to the doctor. And my blood pressure was up to 187/109. And anyway, the bottom line was he said it is vertigo.
Right.
Do you have any suggestions? Do you have a way to
Sure.
cure that?
Yeah, absolutely.
Or prevent it? Yeah, I've never had it before.
Sure. Okay. Well, what happens with vertigo, Mary? The most common thing. It's either the inner ear, it's the cochlear apparatus, or it's the cerebellum, the back part of the brain. So what I do with my patients, and I don't want you doing this on your own, let me do it with you or one of my doctors, is we stand you up and we put our arms around you, but we're not touching you, and we have you close your eyes. And if you start falling to either the left or the right, that's usually a sign that that part of the body is not getting that part of the brain is not getting enough stimulation. So then we
I also had a headache with it. Was that part of it?
Absolutely, all part of it. Yeah, and I get this every now and then too. I have an old brain injury as well, and so I have to work on this as well. And so we stimulate. I got in a car accident. I got hit by a car when I was really young, and it took years to show up.
Yes.
Yeah. So we stimulate that part of the side you fall to, we stimulate that part. Now, sometimes in cases like this, and I tell my patients this, if we adjust your neck, it might be too much for you. And it might, like for me, I can't get my neck manually adjusted very hard because it actually increases my pain. So I have to go very gentle and stimulate, like I fall to the left when I do this test. I have to get the left side of my body stimulated to balance it out, stimulate the cerebellum and then the right side of the brain, and that usually helps. Then we check your stomach because there's something called the vagus nerve, VAGUS. And if the vagus nerve is being irritated, that can cause vertigo as well. So do you have acid reflux or heartburn, burping, gas, bloating?
Oh, yes.
Oh, look at me, Mary. I'm psychic. That could be your cause. So we try to, we're detectives. We try to isolate and analyze where it's coming from. So I'd recommend we check your stomach, we check the cerebellum, we check the inner ear, and we try to find out where it's coming from, and then hopefully we can get it fixed for you.
And I also have a fluid that seems to drain out of my right ear, or when I lay on my right side.
Look how smart.
Could that be connected with it?
Yeah, absolutely. Sure. An infection can do it. See how many?
I have a second question that is really important.
Okay, go ahead. You got 1 minute.
Is there a way to cure macular degeneration or improve it?
Oh, yeah. Mary, you're singing my song. I have macular. This is like they're asking me my questions. Everything I have. I have the headaches, the neck pain, the dizziness, the sciatica. I have macular degeneration. I was diagnosed about 5 years ago. I started taking Dr. Joe's Super Greens and Dr. Joe's Essential Source religiously, once or twice a day. 2 years later, I went to my eye doctor. He took another picture of my eye, put the two next to each other, looked at me, and started shaking. And I said, Doctor, what's wrong? Dr. J, I won't say his last name. He said, your macular degeneration. I thought, oh, my God, I got a brain tumor. I said, what's happening? He goes, it's improving. He says, macular degeneration never improves. He says, and this is the first time in 35 years of practice he's seen somebody improve. I just went last week for my third follow-up to this, and he has a new doctor there. I saw her last year, and she's a young doctor, really excited. She put all my pictures together and went, this is unheard of in the history of eye doctors. Every time we take a picture, your macular degeneration is improving. It's about 80% improved from where it was.
Do you think that it would help on someone 94 years old?
Why not?
Okay.
I mean, what do you got to lose? The Super Greens, the Essential Source, everyone should be taking that, in my opinion. One of the benefits I got from it was it started to get my macular degeneration better. So I believe everyone should take Super Greens and Essential Source. They're two powders. It's fruits and vegetable powder, prebiotics, probiotics, digestive enzymes, alkalizing things like wheatgrass, barley grass, and alfalfa grass. It's powders. I mix them together. I have them here at the studio with me. They taste great at least once a day. Now, if I'm going to go out and go on a date, if I'm staying up late, if I'm going hiking, I'll take a second dose. But relatively inexpensive for what you're getting, and results overwhelmingly. I mean, every now and then, I don't think anyone's ever complained about it. So I would certainly try it. What do you got to lose? It's pretty cheap, and if it doesn't work, it didn't work. You took something good for you.
Well, my mother's lost one eye, division in one eye. And
got it, yeah.
On the second
no,
eye.
absolutely. And that's on the website, drjoeesposito.com, or you just Google Dr. Joe, #1 Dr. Joe in the world, and it's right there on the website under store. Okay? I got to go to break, Mary. Thanks. And, folks, if you have a question, 844-44-Dr. Joe. Again, the website, if you want to order Super Greens, Essential Source, Intestinal Cleanser. My books are there. If you've never read any of my books, they're really good. We archive videos. Follow me on Facebook. Follow me on Instagram. Follow me on a YouTube channel. We'll send out a lot of good stuff next couple of weeks. Hey, tell your friends about the show. We'll be right back. Hey, everybody. Thanks for being here. I am Dr. Joe, the aforementioned. Glad you could be here with us. We're talking today about the opioid crisis and the new guidelines that are coming down, which makes me very excited. Believe me, this is a lifetime of work finally coming to fruition and recognition coming through. And the National Association of Attorneys General sent out a letter to the insurance companies saying that, listen, guys, you got to start covering things that are not drug-related because in the long term, everybody wins. You will save money, statistically. Society is helped. Patients are helped. Why wouldn't you do this? And I never understood this with insurance companies because study after study after study after study has shown that when it comes to back pain, chiropractic is the most effective, least expensive treatment in general, overall, statistically, for low back pain, and now they're coming out for studies on neck pain as well. So the studies are there. The insurance companies know they'll save money if they do this. Well, maybe they don't know it, obviously. because the insurance company is not concerned about you. The insurance company's job is to save money. I mean, they have a board of directors they have to answer to, and their job is to make sure they're collecting as much and spending as little as possible. It's a business. But they're doing it wrong. Even though I don't agree with morally what they're doing, ethically, I'd disagree with that too. But here they are for financially. We know that these treatments work. The National Association of Attorneys General sent a letter out saying, guys, you got to start covering things better, like chiropractic care, massage, physical therapy, acupuncture, so that you'll save money, society wins, nobody loses. So it's a no-brainer. It's absolutely no-brainer. You ever have something in your life like that where you're thinking, how stupid are you? Here's the answer. Just do it. And there's the answer. So it's nice that the state attorneys, the National Association of Attorneys Generals are stepping in and saying, we can't make you do it. You're a private company, but you'd be silly not to. Let us give you some incentive as to why you should be doing it. And here's the reasons. The Joint Commission, which is a group that accredits over 90% of the hospitals and a lot of healthcare groups in the country, are also saying the new guidelines are, before we start giving opioids, let's consider something gentler like a nonsteroidal anti-inflammatory and certainly things like chiropractic care. In fact, the Georgia Chiropractic Association, I'm on their board, one of the boards of public relations. And we're launching a whole campaign now on how chiropractic should be the primary treatment when it comes to back pain. And doctors across the country are agreeing, because I get referrals. 30 years ago, I never got a referral from another doctor, ever. And now I get taken out to lunch, I get taken out to dinner. Doctors ask me to come into their offices to discuss the protocol for referring patients to chiropractic care. So you're seeing a dramatic change, especially in the past 5 years, of how all the professions are coming together for the benefit of the patient, which is really exciting. And for years we thought, well, if I refer a patient out to a neurosurgeon, I'm going to lose the patient. Well, even if I do lose that patient because they were a better neurosurgical candidate than a chiropractic candidate, that neurosurgeon is now going to refer me patients saying, well, maybe you're a better chiropractic candidate than a neurosurgical candidate. And so we're all starting to make nice for the first time ever. And it's really exciting to see this. And now with the National Association of Attorneys General, the Joint Commission, are all saying the same thing. So hopefully 2018 is going to be huge when it comes to patient care. And I'm excited about this. And the insurance companies, all they got to do is open their eyes and say, oh, wait a minute. It's cheaper to send them to a chiropractor first? Yeah, it is. And then doctors, by the way, if you don't know, we're in a doctor shortage right now, and it's going to get a lot worse in the next couple of years. Doctors are dropping out left and right. They're retiring. They're closing their practices. We are in the midst of a doctor shortage. So hopefully logic will take over here, and the world will start to see that, okay, we don't have as many doctors. What's the best way to treat the patient now? Well, here we go. And everyone's agreeing to that. All right, let's take a few more callers. If you have a question, 844-44-Dr. Joe, and then we'll talk a little bit more about what's happening. I know the Georgia Chiropractic Association is launching a big effort to push this concept, and I think state associations across the country are probably going to follow us. Jim, how can we make your day better?
Great to talk with you again, Dr. Joe.
Thank you.
I spoke with you a few years ago. My daughter has epilepsy, and a form of epilepsy called Dravet syndrome.
Okay.
A medically resistant form of epilepsy.
Sure.
And when, of course, we use upper cervical specific chiropractic care.
Good.
And it has definitely helped my child, but she's also now, to try to help take the edge off, we're using cannabis. She has a card that went through the registry.
Good. Uh-huh.
And we went, Dr. Joe, about 2 weeks ago, 12 days without a seizure. That's the longest we've been in 10 years.
Wow.
Without a seizure, due to using cannabis. And I called on regards to the opioid crisis.
Right.
Cannabis is a safe, proven, effective alternative medicine to the opioids. But we are having trouble getting the medicines here in Georgia. We're having to, and it's a heck of an underground right now going to get the safe medicines for our children here. And that's what I'm saying. For back pain, chiropractic definitely works. But also cannabis is a great safe. Like I say, it's a non-addictive medicine for the opioids or for the back pain. So.
I don't have any problem with cannabis oil. I mean, it's not the pot you smoked in high school and college. It doesn't have the THC in it. So absolutely, I have no problem with it. If it works and it's safe, absolutely. And again, you're doing the right thing, Jim. You're also getting to the cause of the problem. You're not just saying, I'm going to rely on the drugs, which is what all the new guidelines are saying. Don't just rely on the drugs. Let's see what else you have. So, Jim, you're way ahead of your time here.
We, Dr. Joe, we've always tried to practice cause and effect.
There you go. Just makes sense, right? Yeah.
You're going to have the effect. I mean, it's like I've told them before. I said, you take a chiropractor if you have a hole in your tire in your vehicle. The chiropractor fixes a hole in the tire. They don't give you an air compressor to pump your tire up every day.
Oh, I like that. I'm going to steal that from you, Jim. I like that analogy. Well, good, Jim. Keep up the good work, and I think what you're doing is right on. I appreciate your call. Thanks so much. And, folks, that's it. And Jim was right. We try to get to the cause, and now sometimes we can't get to the cause. The pain is there. It's not something that is treatable, and that's when the drug therapy becomes so helpful. And this is why so many universities and hospitals are saying, okay, now it's time to start talking about the alternatives. And again, if you're just tuning in, if you do work for a healthcare group and you would like me to help you set up the protocols for this, you can go to my website and contact me, drjoeesposito.com, so you do follow the new Joint Commission guidelines and you don't run the risk of losing your accreditation. So, and a car accident, I didn't touch about on this one yet, but car accidents, and I see a lot of car accident patients, because if you were in a car accident, if the car was damaged, you were damaged. 100% of the time. I have never in my entire career saw a car that was damaged where the occupants weren't. Now, sometimes people get in accidents, they say, I'm fine. I don't have any pain. And I want to say yet. Because if your head snaps around, you can't handle the force of that would damage a car. Your neck can't handle that force. The joints will jam together. There'll be inflammation. Sometimes the pain is instantaneous. You can have up to 6 months before the pain shows up. And then patients come to us sometimes 6 months later. Of course, the insurance company is going to say, deny, responsibility. Oh, I don't care. It was 6 months ago. We're not going to treat that. And then scar tissue can start to form. And many times I have patients that are on opioids that started from a car accident years earlier. So, folks, if you were in a car accident, I don't care if it was yesterday or 50 years ago, if you were hurt, if the car was hurt, you were hurt. Folks, got to go to a break. If you have a healthcare question, 844-44-Dr. Joe. If you want to reach my office, for whatever reason, my office is 844-44-Dr. Joe rings through to my offices when I'm not there. My website, if you want to order Dr. Joe's Super Greens, Dr. Joe's Essential Source, Intestinal Cleansers, my books. If you have questions, all on the website, and archive radio shows, drjoeesposito.com, or just Google Dr. Joe. Follow me on Facebook. Follow me on Instagram. Subscribe to my YouTube channel. Sign up for my newsletter. That's on the website, too. It's no charge, drjoeesposito.com. Hey, don't go anywhere. We're going to be right back. Hey, folks, thanks for being here. Appreciate you taking time out of your day to spend it with us. We're talking today about the new guidelines for pain management, which is really exciting. So let's talk about some facts. 91 Americans die every day from opioid overdose. 80% of the U.S. consumption of world prescription of opioids are in the United States. 25% of all workers' compensation costs are related to opioids. So workers' comp, I always talk about car accidents, and if you've ever been in a car accident, you need to come see us or get to a qualified practitioner. But 25% of workers' comp as well. So if you work for a company, folks, if you're in my areas, put my team doctor on your workers' comp list, my team of doctors. And if you're not in our areas, find yourself some qualified doctors to put on your workers' comp list. It's going to hopefully save you a ton of money. $56 billion a year, U.S. prescription opioid abuse cost. It's pretty expensive. So you really want to stop using them if you can. If you can't, hey, I understand that. But if you can, I recommend you do. Let's go back to the callers. Leslie, how can we make your day better?
Hi, how are you?
I am just so happy you called, Leslie.
Well, my husband is very happy I called, too. He says you are the man.
Oh, your husband's a smart man. He's got great taste in women, and he's a smart man. See that? Yeah.
Thank you. I don't know what they told you about what I was calling about, but
you wanted to know if I was single, and no.
Well, I know, but I have a form of eczema, and it's called dihydrotic eczema.
Okay.
And it affects the soles of my feet and palms of my hands.
Yep. Mm-hmm.
And basically, it just puts I don't know how many blisters, all these little tiny blisters on the bottom of my feet.
Yep.
And I have been dealing with this for 5 years.
Okay.
I went to countless dermatologists. I went through 16 rounds of steroid treatments.
Wow.
I've been on methotrexate, and some other pill I can't pronounce. right now I'm taking azathioprine, and nothing seems to make it go away.
Okay.
The steroids work, but as soon as I come off of them, it comes back with a vengeance.
Sure. Well, what you're telling me,
I don't know.
The steroids.
I don't know how to fix it.
Well, I'm going to give you some advice, Leslie. The steroids help suppress your immune system, and so what's happening is you're having an immune reaction, an overreaction. The immune system is just going crazy. So here's a couple of suggestions I'm going to suggest you do, and if it doesn't work, guess what? So what? Didn't work. Number one, I want you to cut out all your wheat products. That's wheat, barley, rye, anything with something called gluten in it. Because there's two things with wheat. Number one, it could be the gluten. And number two, a lot of times if it's not organic wheat, it's sprayed with glyphosate, which is a weed killer. And they spray the glyphosate on it, and they do this now with a lot of crops like corn too, to kill the plant so that it's easier to harvest. Well, where do you think all this glyphosate goes? Well, it gets into the food that you're eating. So some people are not having a reaction to gluten, they're having a reaction to glyphosate. But either way, just don't eat it, okay? Second thing I want you not to eat is dairy products. And that would be anything dairy, butter, cheese, yogurt, ice cream, anything from a cow or a goat. Now, there are substitutes. There's coconut milk, almond milk. There's plant-based butter products you can use. So I want you to stay away from all wheat and all dairy.
Oh, wow. Okay.
Let's see what happens.
Nobody has ever told me that.
Well, that's why you call me, Leslie.
This is true.
And I always say, let's assume it doesn't work. So what? Didn't work. But it probably will, because most of these cases that I see like yours respond very well to wheat, but I want to get the dairy out of there as well. And let's see how you do.
I've seen it inflame more if I drink milk, because sometimes I crave milk. And the more milk I drink, the more it seems to. I've noticed it. It does mess up more when I have milk.
See that, Leslie? I've read your mind. Now cut out the cheese and the butter and the yogurt and the ice cream, because those are also dairy sources as well. The number one food allergen is dairy. Number two food allergen is wheat. So let's take those off the list. And don't even have a little. If you have a little, it starts the whole process over again, okay? So zero wheat. And now, if you have holidays, you have birthdays, hey, you can't do it. Sorry, gravies have wheat in them sometimes. Just be really, really, really careful, and let's see what happens, okay? From a topical standpoint, go ahead.
I'm sorry. I was going to ask you about your greens, but go ahead.
Well, that was going to be my third thing, but I'll let you jump ahead. Ask me about my greens.
Okay. I just wanted to know, would that help someone that's not great with their vegetables or anything else? Because I'm not great with eating that.
That's why I invented them.
Do you think that would help?
Yeah, because the essential source is about 10 servings of raw fruits and vegetables in a powder form, 1 scoop. Then we add prebiotics, probiotics, which is going to be good for the immune system. Complete multivitamin. The super greens are wheatgrass, barley grass, and alfalfa grass. Now, it's wheatgrass, so it doesn't have the gluten in it. So don't worry. People with gluten sensitivities can eat it. We add omega-3 fatty acids to it. Chlorella and spirulina, best source of omega-3 fatty acids in the world as an anti-inflammatory. We add iodine in the form of sea vegetables, which will help tremendously with your thyroid gland, which can help your immune system. So I feel everyone should take Super Greens and Essential Source, and there are guidelines I have on my website to follow. But everyone, I think, should be taking it, because in most cases we get some amazing results with that. So, yes, you and everyone else listening should be doing it. It's really inexpensive. It's about $2.50 a day. And a lot of people report, it's real cheap. When they take it, they eat less food because they're not as hungry, and they're saving money by taking it because they're eating less food, which is kind of cool. So I would say the Super Greens, the essential source, and then the topical, I would say you can try some extra virgin coconut oil. Use organic.
I do use that.
Perfect. Good. Add a little.
That's the only thing I could put on there that doesn't burn it.
Amazing. If you could put a drop of tea tree oil in there, and if that, just put a drop and see if that irritates it. If it does, then you can try some organic oregano oil, or try that as well.
Okay.
Oregano oil, yes. And let's see if that helps, because that might be one of the secrets as well. So you can do external, you can do internal, you can do Super Greens and the essential source, cutting out the wheat and the dairy, and let's see what happens.
Well, I'm going to try that, and I'll also let you know my daughter-in-law is going to be a chiropractor soon.
Yay!
And hopefully after we can get my feet normal, because it has wrecked my body.
Oh, yeah.
Because I've walked on tiptoes, and it's killed me over the last 5 years.
Sure. Mm-hmm.
But so I will try that. Cut wheat out and dairy.
Yep.
I never thought to do that.
That's why we're here.
Thank you so much.
Leslie, when it gets better in about 6 or 8 weeks, I want you to call back and let me know how well it did, okay?
Okay, I will. Thank you.
Thanks so much. I appreciate it. See, folks, when it comes to natural health care, you have to have three things. You have to have a normally functioning nervous system, normally functioning digestive system, and good nutrition. So as a chiropractor, my team of doctors, we work on getting all the joints in the body lined up the best we can. If you have acid reflux, heartburn, burping, gas, bloating, it could be the stomach pushed up against the diaphragm. We have to adjust that. And then we make sure you have a good diet. So at least do the Super Greens and the Essential Source. If you have children, folks, get them checked. Get their spines checked. Children have spines too. And if you have health problems, get off your fanny. Stop suffering needlessly. If you want to come see us, if you're in the area, again, this show is heard coast to coast and around the world, but if you're in my area, go to the website, drjoeesposito.com. You can make an appointment. Follow me on Facebook. Follow me on Instagram. Subscribe to my Facebook page, because we want to naturally get you well and keep you well. Hey, thanks for listening. Tell your friends about the show. We'll catch you next time.